evening, this is Dr. Do again. This video is on alphabetic list of problems. Today I'm going to talk about cirrhosis. First of all, let's talk about what kind of situation associated with cirrhosis warrant emergency visit. Upper GI bleeding, which is called vomiting blood from the varicosis of esophagus blood vessels. This is one of the emergency. If you know you have the cirrhosis and suddenly you vomit up the dark colored or the coffee ground, actually coffee ground colored blood, so you need to visit emergency. The other emergency situation is the hepatic encephalopathy. This is because of the toxin, especially ammonium, accumulate in the blood, so impaired nervous function, so cause the coma. So this is another important or very serious condition. The third, because in this situation I also might have another serious problem. So if you know you have cirrhosis, you suddenly change out to the mental status, go to the emergency room. There's another serious complication for the cirrhosis is the hepatic renal disease, renal insufficiency. So this is also very serious if suddenly you feel like oliguria or anuria without, and also this can cause the electrolyte imbalance. In short time, for example, the potassium will be accumulated if the renal is really lost the function. So that's kind of life-threatening situation. Go to the emergency room, the sooner the better. So this is can you manage at home cirrhosis? No, you have to manage by a physician. So what kind of sign that you know you have cirrhosis? You may not know, you may know. Usually this is a chronic process. It could be caused by the hepatitis B and C, chronic hepatitis, or could be caused by the alcohol. Long-term alcohol drinker can also have the risk for the liver cirrhosis. So because of this, liver is the organ we talked about before. It's located in the right upper quadrant. The major function is synthesize many nutrients like protein, albumin, and other globulin, and also other coagulation factors. At the same time, if you recall, liver is very important in detoxification of the body. Because of the special circulation system, liver has two venous system. Usually for the other organ, for example, the kidney, have one artery, and then becomes a capillary, and becomes a vein. So this is kind of one way in, one way out. And liver has a special portal venous system in addition to the hepatic venous system. The hepatic venous system go back to the vena cava, inferior vena cava, go back to the heart. But the portal venous system is collect the blood from the intestine, the mesenteric artery or veins, collected so that's the first detoxification effect because of this special circulation. During the cirrhosis, this pressure is high, the portal venous pressure is high, so blood backup to cause the varicosis, and that's why cause the acute bleeding. So anyway, we have talked about the causes of this cirrhosis. Let's talk about what are the signs about the symptoms of this liver cirrhosis, hepatic cirrhosis. Usually cirrhosis is an end stage. At the beginning should be just the hepatitis, may or may not have the jaundice, and you feel right upper quadrant uncomfortable. And then like acute phase, for example, hepatitis B, acute infection, may have this kind of experience, jaundice and also a flu-like symptom, and right upper quadrant feel uncomfortable, fullness, and then this could be the very subtle process. You visit the physician, could be treated, and could be become carrier, and could be eradical, or just you're free of the virus. So the long-term carrier, especially, can be determined by the blood hepatitis virus antigen antibody, and this long-term going process can cause the cirrhosis. So this is just a gradual process. Usually, when the cirrhosis get into a certain stage, they're impaired function from digestive system to the renal system and the nervous system. So all will be affected if when the cirrhosis is developed. The symptoms are very subtle, like I said, probably jaundice, a few nausea, vomiting, anoxia, doesn't want to eat, a fullness of abdomen, particularly right upper quadrant. Sometimes because the spleen is also enlarged and congested, so that if your left upper quadrant also feel fullness. So this is because the spleen is congested also. So this is the symptoms for the alcoholic cirrhosis. Again, it is a long-term process. Probably start from the hepatitis, ongoing nausea, vomiting, and sometimes may accompanied by the pancreatitis, may or may not. So this is just the very subtle symptoms, and the mainly diagnosis criteria is based on the lab. The enzymes for the hepatic enzymes elevated 3 or 5 times more than the upper limit or eccentric center. Those are based on the criteria for the physicians. Anyway, for the patient, if you have the hepatitis B, or you have hepatitis C, or you have been drinking for a long time, the physician already warned you, your liver starts getting shrink or cirrhosis, then just follow up with the physicians and monitor your function level, and I'm sure if you're diagnosed as a cirrhosis, you'll be prescribed medications and also the albumin and eating healthy. And so this is the cirrhosis. I did not talk that much, just kind of a remind for those if you have hepatitis B, hepatitis C, or if you have the long-term alcohol drinking history, then I remind you to visit your physicians regularly and follow the advice. In terms of management, it's really up because this disease could be very serious. In addition to those emergency situations, for the regular preventive, of course, see your physician. Your physician each time give you updated information what you should do in terms of manage to slow the progression of the disease. So the purpose for this video is I just brought here to remind that the cirrhosis, the end stage hepatic cirrhosis, could be very severe, could impair, cause the brain coma, and also the losing blood, omitting blood from the digestive system, or impaired kidney function. So it's a reminder for those long-term alcohol drinkers, follow your physicians and try to cut the amount or find a way to eating healthy, including vitamins B1, B6, B12, so to prevent the complications by the drinking alcohol. I'm not saying here advocate for any a commercial, or just in medical standpoint, for your own health, just follow with your physician if you're diagnosed as cirrhosis, or if you have this kind of hepatitis B, hepatitis C infection history, or if you have cirrhosis or drinking alcohol for long term. So this is a video for cirrhosis, very superficial, not a lot of medical information, because I'm sure you need to be managed by your physician in addition to those emergency situations. The take-home message is just to remind you, either you have the chronic history for the hepatitis or chronic alcohol use, see your physician regularly and follow otherwise. So thank you for watching, and I will see you next time.